My name is Barry Stein, and I'm the President and CEO of Colorectal Cancer Canada. Well, one of the biggest challenges that we have actually is faced with all these new precision medicines that are coming down the pipeline. We'll only have phase 2 data because fortunately we can target smaller and smaller subgroups, but unfortunately because of that it's very hard to do short-term randomized clinical trials. So what do we have to do? We're faced with the challenges of health technology assessment in order to reduce the time or increase access for patients to these precision medicines. One of the problems that we have is demonstrating the value of these new precision medicines for governments so that they will reimburse them in the public healthcare system. And a couple of the challenges that we face really are within the agencies themselves, within these health technology assessment agencies. One of them is the lack of transparency, so we can better understand what they are evaluating, what they need to know at the earliest time, so that both manufacturers or as a result of academic trials, they can be better prepared, not just at the regulatory level, but at the HTA level. So this means that we need a fundamental shift in what is happening in the way these drugs are being analyzed, or being evaluated, I should say, at these agencies, so they can, in a very transparent fashion, provide earlier access to these medicines to the benefit of patients. And that requires really a rethinking of how things are done, taking in new concepts such as different endpoints in trials, and also, for example, patient preferences that have to also be incorporated at the very earliest time in the clinical trials themselves. Well, really, it comes from the top of these health technology assessment agencies, and we're starting to see these collaborations internationally between Canada and NICE and other countries, for example. So some of these innovative things that are going on are a sharing and collaboration of, for example, evaluation of clinical benefit. But when it comes to the individual countries, we still have to make our own choices, of course, because not all countries can afford the same, and there are differences within the populations. So the need for transparency and a willingness really to change the systems to incorporate this new dynamic.